Disclosures for this and all episodes in this series can be found on the podcast series destination page, located on education.webmd.com. The following presentation is copyrighted by WebMD Education. No use, broadcast, or recording of this presentation or any part thereof is permitted without the written authorization of WebMD Education. The following podcast was developed through a strategic collaboration with the National Alliance on Mental Illness, supported by an independent educational grant from Takeda.
Hi, my name is Dr. Rakesh Jain, and I am a clinical professor in the Department of Psychiatry at Texas Tech University School of Medicine in Permian Basin. Welcome to this podcast episode, What to Know About Depression and Your Concentration. This is part of the 6-episode podcast series, What to Know About Depression. Today, I'm speaking with Kate. Kate, you and I have spoken before, but for our listeners, can you tell me a little bit about yourself and your experiences with depression and concentration problems?
Thanks, Dr. Jain. So I was diagnosed with depression in the early 2000s, and I got a lovely doctor and started treatment. At the beginning, we tried a few different medications, and some of them helped with certain symptoms I was having, but they didn't help with my other symptoms at all. I felt like I was just trudging through the day, just being functional. And I would still spend my weekends in bed because I was so tired, which is how my depression manifests. So when I talked to my doctor, he would ask me, "How are you feeling?" And if I was less tired and my medication had lifted me up a little bit, I would say, well, now I can get out of bed and now I can go to work. So I'm fine. And he would ask, well, do you remember what you used to be like? Do you feel like what you used to be like? But because of the depression I was experiencing, I had no idea how I used to be like. So because I was so happy to be able to go back to work and stuff, I would just say, I'm fine. But at work, I would be experiencing brain fog and memory lapses. I would be sitting in a meeting, and all of a sudden, I would just not remember what was going on. So when I look back, it does seem like I was having problems with my memory and concentration, but I didn't really fully realize it at the time.
Gosh, thank you, Kate. That was very helpful. And you're not alone in that. This issue of concentration and memory problems and depression is both a vast problem. And I got to tell you, it's vastly under-discussed. And just to remind everyone, major depressive disorder, or MDD, what we're calling depression here, is a mood disorder that causes feelings of sadness that won't go away and a loss of interest in things one normally enjoys. And it can absolutely affect how we feel, think, act, and it can lead to emotional and physical problems. But you know what's interesting, Kate? For many people, their symptoms are bad enough to cause problems in their daily activities. But these problems with concentration and cognition, which pretty much means how you think, can also be a symptom of depression. And some people, just like you, actually describe this as brain fog. So yeah, concentration, memory problems, those are actually part of the disease. And I'm so glad you talked about it. And they can all interfere with one's ability to focus and cause problems with making decisions and remembering. So really, Kate, did you and your doctor talk about this?
Not really. I knew that problems with concentration or cognition could be symptoms of my depression, but what I didn't know is that it didn't have to be that way. And at the time, I also didn't know that the medications I was taking for my depression could be adding to the problem. But again, I was so happy to be functioning again. I didn't talk to my doctor about it. And I felt weird because why would I tell him that some days I was still so tired, I couldn't even focus enough to brush my teeth?
Oh, gosh. Yep, that is, of course, unfortunately, quite common, actually. Patients often are so grateful that the symptoms of depression are better. They often don't bring up the conversation about memory difficulties. So what we do know is that while concentration issues can indeed be a symptom of depression, as you said, Kate, some treatments may also have side effects that can make us feel drowsy or dizzy or have memory problems. So certain antidepressants may be more helpful for concentration issues than others, and patients do need to be aware of that. And this challenge can greatly impact, I'm talking about cognition and memory problems, it can greatly impact someone's daily functioning and their quality of life. And by quality of life, I do mean anything that is important to them, such as raising their children, or being in a marriage, or being in a relationship, even driving, for example, balancing your checkbook. Work, as you said earlier, can all be negatively impacted. And Kate, I have indeed, as a professional, found that many people are reluctant to bring up issues of cognition or concentration with their healthcare provider. And part of it is because people aren't even aware that these kinds of problems can both be a symptom of depression and or a side effect of certain medications used to treat depression. Also, in some cases, medications that could be taken for other conditions, right? For things such as blood pressure or something else, those can cause challenges as well. So it's something that clinicians and patients should indeed be talking about. So Kate, it sounds like maybe you were having some minor incidents along the way that showed you were having concentration and cognition issues, but did something happen that prompted you to have a conversation with your doctor about your memory?
Yes. Looking back, there were definitely things that were popping up. I was absolutely having challenges with my memory, definitely having brain fog. And I can say now that I was having spots in my memory on and off for a long time. But then one day I got lost on my way home from work, and I was so confused. I didn't even know where I was. And I forgot to pick up my son from daycare. It was really scary. I remember thinking to myself, am I having a stroke? So this prompted me to see if making some changes might help. So I found a new doctor. And the first time I was in her office, she had me fill out this questionnaire with it was like a questionnaire and checklist. And there was a question on it that said, how is your concentration? And no one had ever asked me that before. I mean, I never even thought to bringing it up. But when I saw that question, it made me think, yeah, I've definitely been having some problems with this all along.
Wow, that's great. Just being reminded about the question, are you having concentration problems, got the ball rolling for you. That's wonderful. So that tool or resource that your doctor provided really did help you start the conversation, didn't it?
Absolutely, because it was right there. So I knew how important it was to bring it up. So now every time I see my doctor, I can answer that question and we can have that discussion. Even though it can be, for me, it was difficult to talk about, especially at first. And it's also difficult to talk about where you are as far as your feelings are too, because I mean, I don't know if there's really a litmus test for any of this, but my doctor and I talk about all my symptoms and my concentration problems because there were definitely times, like I said, when I was extremely forgetful. And it's important for us to know the reason why this may be happening, right? So we would discuss, was it because I was too tired, which is how my depression affects me, or was it something else? Could it be a side effect of my medication? So my doctor and I went into this in depth, and she ended up adjusting my medication, and it made a huge difference.
Oh, I'm so happy to hear that, Kate. There's so much here that you're teaching us about memory problems and depression. And it's important to know that not only can concentration and cognition issues be a symptom of depression, but that your depression medication or even other medications can be causing or adding to the issue. So being aware that these impairments can happen or are happening is really important. In addition, understanding that this can escape the attention of both a patient and a patient's healthcare provider, that's really important. And the final learning point, Kate, that you're teaching us is if you look for it, you may find it. And if you find it, it's really important to talk to your doctor about it. So, Kate, you having this conversation with your doctor was key, wasn't it?
You have no idea. And by having a checklist like that, I was able to become a partner in my discussion with my doctor. I've had some great doctors before, but in the past, I would just come in and say, like, this is what's happening to me, and then tell them about how tired I was or how hard my day was. But there wasn't any partnership there. They'd be like, oh, that's too bad. So we're going to give you this medication, and perhaps in 2 weeks, you might feel a little different, and then hang in there. And then those questions would come back the next time. How do you feel? Do you feel better? But the difference was to have a doctor who actually sat down and spent time with me every time I came in to talk, and having that checklist that she had too, it was amazing. And I also learned that being more specific helped, because the question just wasn't, do you feel better than your last visit? And then underneath, they would say, do you feel 50% better, 100% better? And how do you feel compared to the first time that you came in? And it was the same with the confusion. And all of these things were able to help me say, oh, okay, I can track myself across time. And if I want to go to my doctor and say, if we look back through these questionnaires, you can see back in March, I felt that this was my baseline. And now things have changed in this or that respect. It's really great. So I think for a long time with other doctors, I wasn't able to communicate with them in a way that was helpful to me, because I didn't have the tools to really be able to gauge what I was experiencing. I was still in, we talk about mental fog, but I was still in my depression, even though I was functional. And when you're inside of something, you can't be objective about it. But now, because I can track myself, my doctor and I can discuss what's happening and what might be next or what might need to change. But talking openly with my doctor with the help of this questionnaire was the first step to finding a solution. Today, my concentration is so much better. And it's because I was able to work with my doctor in such a specific way to take care of things. With the help of my doctor, I do feel like I used to. And it wasn't until the new medications that she's prescribed for me began to kick in where I was like, I remember this. I remember being sharp. I remember being able to do crossword puzzles and enjoy my day and have specific conversations with my friends or my work colleagues. And that has made such an amazing change in my life, the way I deal with my family, the way I deal with my friends. It's really been a game changer. And today I live with depression. I'm not in my depression. And I'm so grateful for that.
Goodness me, just beautiful. This is such great, wonderful advice for all of our listeners. And because everyone is different and everyone who's living with depression can have different symptoms, it's really important to have those conversations, which means that finding the tools and the doctor or healthcare provider that's right for you are going to be key to helping make the difference in terms of a treatment plan that's right for you. So what I would say is, Kate, today you have given us a masterclass in how to really appreciate how memory problems and confusion can be part of depression. It can also be part of the treatment of depression. And the best thing one can possibly do is actually have a conversation with your healthcare provider and remembering all that Kate has taught us, which is not only have the conversation, but remember to talk about remembering and your memory with your clinician. Kate, Thanks so much for joining me today. That was a really good talk, and I appreciate you sharing your story and being so open. And thanks to all of our listeners as well. Goodbye for now.